I thank you for your patience, and I'll now pass over to Dr Murphy.
Thanks, Prime Minister. So there are now about 454 cases of COVID-19 in Australia, and we have increasing numbers each day, but it is important to remember that the majority of cases in Australia, majority of new cases are still imported cases or direct contacts of imported cases, and our focus for those is still the same. We are getting on top of them, identifying them, isolating them, contact tracing. That remains a very, very important part of our response across every state and territory. But we know that there is community transmission. It is low level at the moment, and we know that the way to control community transmission is social distancing. The HPPC met for 2 days this week, and like the Prime Minister said, we have a unanimity of opinion across this country. Every state and territory chief health officer, plus our invited experts, plus our advisory technical committees are united on our approach. Social distancing is really important to prevent, delay, transmission in the community of this virus over coming months. But be clear, a short-term 2 to 4 week shutdown of society is not recommended by any of our experts. It does not achieve anything. We have to be in this for the long haul. As the Prime Minister said, it could be 6 months more that we have to practice these new ways of interacting. So therefore, our measures have to be sustainable. There is no way that we can lock down society, make everyone stay home, and then in a month's time undo that, because the virus will just flare up again without any real long-term benefit. So we have to have sustainable measures, but they have to be serious measures. They have to be effective. And that's why we've put in a range of measures that the Prime Minister has outlined, with more information to come later. But the first thing I would say is that it is every individual Australian's responsibility to practice good social distancing. Keep away from each other where possible. Practice really good hand hygiene. Wash your hands with soap and water at every opportunity you get. If you've been on a public transport, if you've been touching things in a common area, if before and after going to the toilet, if you've been having a meal. Social distancing and hand hygiene is really, really important. But we also have to do things as a societal level, and that's why we've put in those recommendations that governments have accepted to restrict non-essential gatherings. We know that the actual numbers of infected people in our society is very low now, but if you get a lot of people together in close contact, that's the way you can spread the virus. So we need to avoid those large gatherings and limit them, but we also have to keep society functioning. So we are very focused on these measures being sustainable and allowing us to keep going as a nation whilst this virus is with us. I'd like to specifically address schools. In China, only 2.4% of the cases reported in Hubei province were in people under 19. Children have very, very few instances of clinical disease, and even if they do, of even more severe disease. This is quite different to influenza and other respiratory viruses, which have quite severe disease sometimes in children. We know that even in influenza, school closures are a controversial issue. We believe very strongly that it's in the best interest of our children and the nation at this time to keep schools open. There may be occasions when there's a big outbreak in a community that some local school closures might be necessary. But at this time, across the community, our view is that schools should stay open. Now, there obviously are measures that we can take to reduce potential transmission in schools. It's interesting in China that, again, most of the children who were infected were reported as having picked up the virus from adults in their household. But we don't know whether children may be a vector of asymptomatic or transmission with low levels of symptoms. So we need to make sure that our schools are made as safe as possible. We need to make sure that no sick child goes to school. We need to make sure that no sick teacher goes to school. We need to try and avoid large assemblies and other gatherings at schools. We know also that it's not really possible for children in a classroom to keep 1.5 metres apart from each other, and we know that we've got to be practical about that. But schools should practice very good hand hygiene too. Very hard to do in a school, but we can trust our teachers to do it. Children should be washing their hands regularly, particularly when they're eating and particularly when they're touching common areas. So it'll be hard for schools, but it would be much, much, much harder for the society if our schools were closed. We want our children to be looked after in schools. If they were at home, we know that they probably wouldn't stay at home, they would probably congregate anyway, and if transmission were occurring it would happen, or they may be looked after by vulnerable elderly relatives who are the people we are worried about. As the Prime Minister has said, most people with this virus have a mild disease. The people we worried most about are our elderly. That's why we've taken these measures in relation to restricting visits to aged care. But there's no sense in completely locking down aged care. Again, things you could do for a month and then stop would have no long-term benefit. We've got to protect our elderly for the long haul, for 6 months, and you cannot completely deny access to an elderly person in a residential facility to their closest next of kin. But we've got to make sure that those interactions are safe, very limited, and again, with good social distancing. So my final message is every citizen now has to think about every interaction they have with another person during the day. No more handshaking. No more hugging. No more, except in your family. You can do that in your family. No, because you're already close to your family. No more scant attention to hand hygiene. Wash your hands all the time. Use hand sanitizer and just practice sensible practices. And also, as the Prime Minister has said, we are in a situation now where there are mainly imported cases, small numbers. There is no need for us to be in a state of heightened anxiety, but we do need to be prepared and we all need to practice this social distancing. Thank you.
Well, thank you.
We need a bit of clarity for religious groups and churches, synagogues, mosques on how these rules pertain to them, and also what's your view of the footy? Should it go ahead with empty stadiums, both the AFL
and NRL?
The rule is quite clear. Internal gatherings of no more than 100 people. And so churches, mosques, synagogues or others should comply with that. Before the end of this week, we'll be considering further the rules that are established amongst smaller gatherings. There are very practical issues that we have to work through there, and the states are working on that right now. We would also suggest, as I'm sure Dr Murphy would agree, that you practice the sort of appropriate social distancing in those type of arrangements, and that means they're having separation and distance between people who are seated, except for amongst family groups that might be in any of these places. I know my own experience. My church is putting in place practices. I mean, some are moving to online type services and things like that, and that's a sensible, practical measure, I think, that people can put in place. When it comes to whether it's the AFL, the NRL or any others, that's a decision for them to make in accordance to the rules that have been established. No gatherings of more than 500, no internal gatherings of 100 or more, and there'll be other measures that will follow. So they need to make their own decisions about how they manage that. We'll focus on our responsibilities as Prime Ministers, Chief Ministers and Premiers, and the Commissioners of the NRL and the AFL can make their decisions based on what they believe is best for their game, but they must comply, obviously, which they will, with all the health rules and guidelines that are being established.
Prime Minister, would you consider directly?
Sorry, can we just everyone just, yeah.
Prime Minister, is it necessary for the states to enforce new laws to stop hoarding? What I want to welcome is the practical responses that have been put in place by the supermarkets themselves. I think that's sensible. I think putting in the arrangements for elderly to be able to visit shopping centres and things like that in supermarkets, that's just good common sense. And I would encourage them to continue to do those sorts of things. I would at first appeal to Australians to do the right thing. Obviously, there are measures that could be moved towards if we had to do that, but to be honest, I'd be very disappointed if we had to do something like that. I think Australians are better than that.
Prime Minister, you said that this is going to go for about 6 months, maybe more. Can you rule out there's not going to be any widespread school closure in that time?
No, we can't do that. Right now, schools should remain open. That is the clear and crystal health advice from the AHPPC, and that is the clear and unified position of all the states and territories, premiers, chief ministers and myself. These situations will be monitored on a regular basis. The AHPPC meets every day. Premiers and chief ministers this week will have met on 3 occasions. My ministers are meeting every day on these types of issues. I'll be having further discussions today with independent schools, the Catholic schools and others about these arrangements and talking them through with them. School holidays are coming up soon, and then schools will reopen after school holidays. That was the clear position of the premiers and chief ministers, and so this is an issue we'll constantly continue to monitor. But when it comes to managing this, it is about being scalable and sustainable. Any measure you put in place, you must be prepared to put it in place for at least 6 months. It could be longer, and that means you've got to do it and make sure that you can continue to have a functioning country. Phil.
Is it likely or possible you may tighten the restriction on people entering the country, either citizens abroad or non-citizens, beyond the 14-day isolation period?
Look, that is possible, and frankly, though, practically it'll largely do that on its own because the whole world is doing basically the same thing we are. So the great risk now, and the actions that we have taken on our borders to date have been very effective. And that has put us in the advantage position we are in right now. But this challenge now, as it inevitably was going to when you read global pandemic phases, remember we called a global pandemic, and it was particularly Dr Murphy who did, more than 2 weeks out from the WHO. So we started on that basis. Now, the challenge now is moving from the border to the community and managing how this is done in the community. So things about the 500 limit, the 100 limit and other rules that would come from that, that's about managing this in the community, and that's where a lot of the focus is, and that's why the National Cabinet has become so important, because up until the other week, issues of borders and so on is the clear province and domain of the federal government. But once you start moving to managing issues in the community, it needs much greater coordination between the states and territories, and I can't underline to you enough how important the premiers and chief ministers feel it is to have a consistent application of what they're doing across all their jurisdictions. They're very committed to this, and they're very committed to supporting each other in this, and I think that is to be commended. Yeah, Andrew, and I'll come over.
The defences of remote Indigenous communities. Pat Turner, one of the Indigenous
Yep.
board on COVID-19, she's been saying that there's some chronic shortages of PPE equipment, swabs and test equipment, and there's a lack of advice on combating the disease. Perhaps this one's for you, Dr. Murphy, but what assurances can you give to suppliers to get there? And also I want to flag that when you can source questions about COVID-19, I would like to ask about Four Corners and the SAS video, but we can do that.
Well, I might come back to that on another occasion, Andrew, to be honest. I mean, I think there's a lot of questions on COVID-19 and I have a cabinet meeting to go to, so I'm happy to deal with those issues outside the press conference. Andrew?
So on PPE, we know that internationally there are shortages. We have a very aggressive procurement program. Minister Health has been driving that. We are getting significant new stocks of PPE. And we will make it available as necessary. Some people are anxious that they don't have reserve stocks, but we obviously have to keep control of our stocks, and we have an active program with an Aboriginal and Torres Strait Islander response led out of the Health Department by one of our senior doctors, and there's a lot of work that's been happening, and Pat Turner and her team have been involved with that. So we know that there's anxiety about PPE, but we are getting lots of PPE in, and we are even looking at the Prime Minister's direction at local manufacturing. So we need to be prepared, but we cannot waste what we've got at the moment.
Adults can obviously have symptoms or not have symptoms and be contagious as well.
Sorry?
Adults can obviously be asymptomatic as well, and we've seen in the last 24 hours information that a Liberal Party donor who attended a Liberal Party fundraiser last Tuesday night with you and Peter Dutton, before Peter Dutton was exhibiting symptoms, has now contracted the illness now. Of course, he doesn't know exactly how that occurred, but the only known contact he had who had the coronavirus was Mr Dutton. Do you think now, out of an abundance of caution, that it is worth yourself being tested, Cabinet being tested, just to ensure that there is nobody who is actually spreading that within the community, having potentially contracted it from Peter Dutton?
The Cabinet is following the same rules as every other Australian. I mean, last night I had a medical checkup, and my health is being checked on a regular basis by one of the doctors here, and that involves the normal things that you'd expect. And if I'm advised by my doctor to get a test, then I will. What I'm saying is that there can't be one rule for me and another rule for the rest of the country. Testing equipment is an important resource, and I'll follow the rules like everybody else. I've already put in place arrangements with the Cabinet. We're meeting now virtually. We're not gathering the Cabinet all together in one room. The contact tracing on that event has already been undertaken, and so where that has led to the need for tests to be undertaken, where people are exhibiting symptoms and have had contact, then people will undertake those tests. There have been a number of Cabinet members who have had tests, not in relation to that incident specifically, but where they have satisfied the case definition, which has been set out by the Chief Medical Officer. And I can assure you, in all of these cases where there has been a question arise as to whether that should be done, we have consulted with either the Chief Medical Officer or the Deputy Chief Medical Officer, and I'll just keep taking their advice on what's the most important thing to do, and I'd encourage all Australians to do the same thing. But I was pleased that I got a good tick last night from the doc, and I appreciate that, but I intend to see him fairly regularly in the weeks ahead, because I intend to stay as fit and active as possible. Yeah.
Well, how do you characterise the number of cases in Australia, and how do you characterise the future trajectory? Are you seeing what you expected?
There is no clear expectation. I think at the moment, as I said, we are seeing a growth in case numbers, and they are obviously concerning. But as I also said, they are still largely fueled by imported cases. We expect imported cases, as international travel declines, to drop significantly. The challenge is to reduce those community transmission that we're seeing in small pockets at the moment, and that's what the social distancing is about. So obviously, every increase in cases concerns us. We would be more concerned if the increases were all community transmission, but even with imported cases, that presents opportunities for further community transmission, and we are concerned in getting on top of it. But there's no one prediction that you can make.
So at the back here, and then I'm going to come over here, and then over to Kat. We'll try and get through as many questions as possible. So, yep.
You mentioned 6 months. We're already seeing industries struggle. We're seeing parents anxious, people lose their jobs, people fighting in supermarkets. Mental health charities are saying they're seeing a spike in services as a direct result of the virus. How, as a federal government, can you, as your primary job, keep Australians calm?
This is what we're doing here right now, making good decisions based on good advice and communicating them as clearly as we possibly can, and to keep focusing on the issues we need to make decisions on every day. We are meeting every day either in full Cabinet or groups of Cabinet ministers and working with industry groups, working with all the bodies that you're talking about, identifying the issues that are starting to present. This thing is moving very, very quickly, engaging with international leaders, and we've had quite a bit of progress in the last couple of days, particularly on moving towards a meeting of the G20 finance ministers meeting, and central bankers. The Reserve Bank is considering measures over the course of the next sort of 24, 48 hours. We're staying on this. We got ahead, but you've got to work very hard to stay ahead. We're learning from every bit of advice we can get, and we're keeping people together. And again, the National Cabinet is so important in a coordinated national response to these events. I hope, and it is certainly all of our hopes as members of that National Cabinet, that Australians would take confidence from that all issues of politics, and doesn't matter what party you're in that National Cabinet. There are 5 Labor members and there are 4 Liberals, and we are working together as one united team to deal with the issues that we have been sworn in to deal with. You know, when you go down to the Governor-Generals or you go to your state governor and you take an oath to say you're going to do the right thing by the people of your state or the people of your nation, that's what we're doing, and you're seeing that exhibited in the way that this National Cabinet is working together.
And the style of communication,
misinformation is gaining significant momentum online. Do you actually have, and would you implement some kind of proactive, coordinated communication strategy to target and basically refute some of those claims, or are you still relying on people just finding their way through the health.gov.au website, which by most accounts is fairly user-friendly?
Well, that's your view. What we will continue to do is upgrade our communications campaign and ensure that we're getting the best possible information to people out, and that campaign is being upgraded on a daily basis in terms of how it can respond to some of the issues. It's disappointing that we would have to try and refute and correct a lot of the information that is out there, and I just simply appeal to media to ensure that they're going to the official sources of advice and not reporting Twitter as if it's news or anything like that, because it's not. It's not real. It's gossip and nonsense in most cases, and it's important that we report the facts on these things. So everyone's got a role to play, I think, to help ensuring that people are getting the right information, and we will seek to counter those things directly, as I've done here today. But whether it's in the part of the social media campaign that's being run by the government, or indeed the direct communications campaigns we're doing, it's all designed to get that information out to people. Yeah.
Prime Minister, will you now consider direct payments to all Australians following Donald Trump's moves in the US overnight, or do you still prefer a much more targeted approach to social payments?
Well, we have a far more wider and more effective social safety net than most countries in the world. It's one of, I think, the great boasts of Australia is not just our medical system, our health system, and the way that operates. Equally, our social security system is a well-developed one, and it's both targeted in nature, but it also has a broad safety net benefit to the population. And we'll be announcing further measures on these matters once they're finalised. Kath.
Just sticking with the stimulus, and I've got a question for Dr. Murphy as well. But you said, I think, before that round two would be announced once it's properly designed. Does that indicate that you're looking for round two, that there might be new programs? Round one, you delivered all within existing programs, tax transfers, etc. Are you looking at new programs for round two? And also, Dr. Murphy, if I may, you said that your group, the AHPPC, is that the right acronym? Sorry, met for 2 days this week, and there was a unanimity of views. Did anybody within your group express a view at any point that the crowd limit of 100 should have applied before today, as in a couple of days ago? Should have been applied a couple of days ago?
Let me deal with your question first. The same principles that applied to the policies we announced last week on the economic stimulus measures are applying to the measures that we're now working on, and there's a very practical reason for that. They work if you deliver them through existing systems and mechanisms. They get to people quicker, and so those design principles are the same ones we'll be applying for those arrangements. The task is different to the one that the Treasurer and I spoke of last week. The task of this next set of measures is really about trying to cushion the impact. I can't understate the significance of the gear change that occurred on the last weekend. The gear change when we were moving to far more widespread social distancing and bans on gatherings and all of this. This has a much more profound impact on the economy. And there are many things that will be hard to predict going forward, but as we adjust and upgrade and scale our response, then that will also require adjustment to other responses that we're making. And I think in the area of the economic impact, what we're seeing here is we haven't seen this for a very, very long time. Certainly in living memory, and that's for some who have lived a very long life. As I said, we haven't seen a pandemic on this scale globally or something of this nature going back to 100 years ago. And so it was a very different world back then. And today, that puts us in quite unprecedented response territory. But I'll allow Dr. Murphy to deal with the other matter.
So last Friday, HPPC was strongly of the view that it was time to really up the ante on social distancing. And we have been, we've since then, talking about both internal and external gatherings. At the time on Friday, our recommendation to the National Cabinet was to implement the mass gatherings for 500 people externally. And we were instructed to come back and look at internal gatherings in this meeting over the next 2 days, and that was what we did.
And I just want to take this opportunity to welcome viewers on ABC1. We're listening into a really important media conference with the Prime Minister, Scott Morrison, and the Chief Medical Officer, Brendan Murphy, about coronavirus.
We'll make a decision on that. These are things that, I mean, all of these issues are up for review right now. Right now, the key economic package that I'm focusing on with the Treasurer and the Finance Ministers and the other members of the ERC, we spent quite a lot of time together, most of us by telepresence, on working through those issues. And so that is the package that we're most focused on at the moment. And when it comes to the budget, there are no plans to change that at the moment. But if that changes, then we'll let people know.
Doctors have said, asked the Premier in WA to consider voting off WA, trying to limit the spreading out states that are far away from everyone else, obviously. Does that have merit, in your opinion? And Mr. Morrison understands it might be brought up by Mark Brown yesterday.
Sorry?
To close off WA, if that's something that would be considered.
Well, first of all, that's not something the Western Australian government has supported, and that's not a measure that is being recommended by the AHPPC or any medical officers. The only issues of closing off particular areas is sensitive areas. So, you know, places where especially there's remote Indigenous communities, and this is already happening in parts of the Northern Territory. And that, if anything, in some of those communities, it's about keeping teachers and others in those communities and ensuring that people don't leave and come back. So, you know, the issues that have to be addressed here are principally around health. And if there's a health reason that you'd want to isolate particular areas of the country, well, the powers exist for that to happen now. And as I flagged in my opening statement, the premiers and chief ministers are working together with the Commonwealth to identify what areas of the country need to be subject to such an exclusion zone. As I said, it's not being on the plane that's the issue, it's where you might be coming from and going to. Now, take that as a general rule, next week the Parliament will resume. There'll be 60 less members in the House of Representatives, and there'll be 22 less or thereabouts in the Senate. That means there will be less than 100 people in the main chamber during the course of next week's sittings. And those pairs, which is basically 30 each for both the government and the opposition, I thank the opposition for their agreement to these arrangements. And I spoke to Anthony Albanese yesterday morning. That will mean that we'll be able to deal with the essential legislation, but those particularly relates to this event and both the economic and health measures that need to be passed. We will have a question time. The opposition have asked for that. I'm happy to have a question time on the days that the Parliament is sitting, but the intention is to get through that legislation as quickly as possible. But the people we are saying not to come to Parliament next week are particularly those for some of those more remote areas like the Northern Territory, North Queensland, parts of remote South Australia or Western Australia. We're encouraging those members, particularly those who may be more elderly members of the House or the Senate, also not to attend, and obviously those who are in self-isolation or things like that. Brendan?
So it is impractical to fully isolate a large part of the country. This virus will spread. But as the Prime Minister said, it is really important to isolate vulnerable people. So our focus is on trying to protect aged care facilities, remote communities, anywhere where there are vulnerable people getting this virus coming in, to protect a large part of the community. Isolation might delay entry of the virus or community transmission, but it will not prevent it.
Okay. Thank you very much. I'm sorry. I've got a cabinet meeting, so we're going to have to go. Thank you very much.